Alright, these are the tools you're going to need for a blood draw. You're going to need gloves, your tubes, an alcohol prep pad, cotton balls, Coban, a tourniquet, and there's 4 types of ways to do a blood draw. There's the most common way, which is just with regular needles. You're going to take the bottom off, screw the hub into it, and here's your needle. And then for the second one, you're going to use a syringe, just like this. It's called a straight stick. It's not common, but it does happen. And here's the needle. And then the second one also uses a syringe, but it's called a butterfly. And the needle is a lot smaller. And what you do is you take this pink cap off and then put the syringe into it, just like that. And the last one is a regular butterfly, and it's just like the first one. You put the hub into it, and the needle is bigger as well. So you just take this off, put the hub into it, and that's it.
The first thing you're going to do is you're going to greet your patient and explain the procedure. Hi Elizabeth, I'm going to be drawing your blood today. Okay. So the first thing you're going to grab is your tourniquet, and you're going to put it 4 fingers above the elbow crease. And the way to tie a tourniquet is to wrap it around pretty tight, and you're just going to fold it in and leave it like that. I'm going to have you squeeze your hand. And the way you're going to look for a vein is with any finger but your thumb, and the vein feels bouncy, and if you bend the arm, it should disappear. You have a pretty good vein right there, miss. Right. The next thing you're going to do is clean the area in a circular motion. While that's drying, you put on your gloves. You're going to connect the needle to the hub. Make sure you always have your cotton ready. You ready?
Yeah.
Okay, and then you squeeze your hand again. You always want to have your bevel up, and you always want to make sure all your supplies are right here, and so you don't have to reach over the patient. You ready? So you're going to lift it to anchor the vein. You go in at an angle. And the order is tourniquet, tube, needle. You cap it. Can I hold that for you? Thank you. Alright, go. And you want to have it tight with the Coban. There you go.
When doing blood draw, there are 3 things that you should remember. Never check an artery with your thumb because it has a pulse itself. There's a specific order of draw that you should do, and there should be ways to remember them. And generally, you have to do coagulants second and non-coagulants first. And also, when taking a blood draw, remember to remove it in tourniquet, tube, needle.